Ovulation period. The ovulation period does vary among women of reproductive age and can be affected by factors such as stress, illness, and hormonal imbalances, just like how they cause changes in the menstrual cycles. There are several methods to tracking ovulation, including using ovulation predictor kits, monitoring cervical mucus changes, and tracking of basal body temperature. The ovulation period is the time during a woman's menstrual cycle when an egg is released from the ovary and made available for fertilization by sperm. It is typically a window of time that lasts for about 24 to 48 hours, occasionally more than 48 hours in an actively fed woman of reproductive age, i.e. balanced diet, potentially free of infection. In a typical menstrual cycle, ovulation occurs approximately 14 days before the start of the next menstrual period. However, this can vary from woman to woman and even from cycle to cycle. Factors such as stress, illness, and changes in weight or exercise patterns can affect the timing of ovulation in relation to the menstrual cycle. To help identify when ovulation is occurring, women can track changes in their menstrual cycle and symptoms associated with ovulation. These can include changes in cervical mucus, changes in basal body temperature, and ovulation predictor kits that detect the surge in luteinizing hormone, LH. That triggers ovulation. It's important to note that while the ovulation period is the most fertile time in a woman's menstrual cycle, pregnancy can still occur from intercourse that occurs several days before or after ovulation, as sperm can survive in the female reproductive tract for several days. Tracking of ovulation via signs and ovulation period. Tracking ovulation via combination of ovulation signs and period is possible, but you have to understand that this differs among the women. A lot of apps, kits are available for tracking the ovulation period, but all these are built, as I said earlier, based on a regular menstrual cycle. It would be advisable that you try to understand your own system, most especially if you are newly married and you are new to this process. In my 5 years experience in medical practice, I have been using the following methods and have proven effective to 50 to 60% of my patients, especially in the area of achieving pregnancy in newly married couples. However, diseases and structural factors may contribute to the inability of some couples to get pregnant. I will address one of them in this book. While you see your doctors in case you see no changes, I would be given a practical example of my method in a very simple way using the 2022 calendar period. Calculation of ovulation period. 1. To get this right, you will need 3 menstrual cycle intervals using 4 months menstruation period. 2. Assuming you menstruated on January 20, 2022, February 22, 2022, March 20, 2022, and April 21, 2022. These are what I called 4-month menstruation periods. 3. Your menstrual cycle is counted starting from the first day of your menstruation till a day prior to the next menstruation, e.g. January 20, 2022 till February 21, 2022 using the above menstruation date. 4. Menstrual cycle. First menstrual cycle is from January 20 to February 21, 2022 equals 33 days. Second menstrual cycle is from February 22 to March 19, 2022 equals 24 days. Third menstrual cycle is from March 20 to April 20, 2022 equals 33 days. Summation 33 plus 24 plus 33 equals 9 days. 90 days, 3 equals 30 days. It means that you have an average of 30 days menstrual cycle. Divide this by 2 and this gives you 15. This simply means for every month you menstruated, your fertility period or ovulation period is on the 15th day of your menstrual cycle. This 15th day could be any calendar day. E.g., assuming you menstruate on the April 21st of 2022, then count from that April 21st. This is the first day of your menstruation, also known as day 1, till 15th day of that menstrual cycle, which is May 5, 2022. Your ovulation period for this cycle that started 21st of April is 5th of May. However, I do like to add plus or minus 4 days to this ovulation period for some reason, such as 1. There might be alteration to the process resulting from stress and other factors. 2. To keep you safe in case you don't want to get pregnant yet. 3. Due to ovulation signs and symptoms that vary among some women, WHO are outside the regular menstrual cycle. 4. This also is to allow for survival time for both egg, 24 to 72 hours, and sperm, 3 to 7 days. Therefore, plus or minus 4 days equals 11th 19th day of the menstrual cycle. I refer this 11th 19th day of the menstrual cycle as the fertility phase of the reproductive age group. Therefore, the month of April 21st, your fertility period become 1st 9th of May, 2022. There is assurance that if you meet your spouse at this interval, provided no other factors such as diseases are present, you will surely get pregnant. As I said at onset, this method has worked for a lot of my patients, especially those that are newly married and seems things are getting longer than expected. Note: I refer to the other method as phase 2 of the above due to the fact that every woman has 2 ovaries. I believe these 2 ovaries do not release their ovum once, which means if one release in this menstrual cycle, the other one drop the following cycle. It means one of them can ovulate as close as to the period of a new cycle. That is why you heard someone saying, how is it possible for them to still pregnant despite been menstruated in the same month? In view of this, I normally says that once you know the average cycle of your cycle, then you can likely predict the next menstruation period. How? Count 7 days backward from the next menstruation date, e.g. assuming your next menstruation is the 21st of April, then counting backward by 7 days equals 14th of April, 2022. Starting from 14th of April 2022, both couple can have sex alternatively and still achieve pregnancy. Note: a lot of things can cause delay in achieving pregnancy, but I will only mention one of the commonest ones and its treatment, while I will leave the rest to your physicians and gynecologists. The next chapter will cover signs and symptoms of ovulation in relation to natural ways of preventing pregnancy, knowledge and treatment of pelvic inflammatory diseases, which is one of the commonest causes of delay in pregnancy. Thanks. Kindly click the subscribe button to follow me.